Truth is, Canada is far from a perfect country, with many mistakes in its past, but there's still mistakes happening today, with racism being still a very prevalent issue. This video will be talking about specifically racism in healthcare, examples and possible solutions with a focus on three of the 94 calls of action. Call to action number 20 is calling upon the federal government to recognize, respect, and address the distinct health needs of the Métis, Inuit, and off-reserve Aboriginal peoples. Number 22 is calling upon those who can affect change within the Canadian healthcare system, recognize the value of Aboriginal healings practices, and use them in the treatment of Aboriginal patients. Number 24 is calling upon the medical and nursing schools in Canada to require all students to take a course dealing with Aboriginal health issues, including the history and legacy of residential schools, UN Declaration on the Rights of Indigenous People, treaties, and Aboriginal rights. The official site of British Columbia published reports addressing racism from an independent investigation into Indigenous specific discrimination in BC healthcare. From the investigation, over 9,000 people were directly interviewed for this data. From the Indigenous respondents, 25% feel that they always are assumed to be drunk, dishonest, or bad parents. When both Indigenous and non Indigenous people were asked if they felt like they were taken seriously and they had received the medical help they asked for, 59% of non Indigenous people said they did, while only 31% of the Indigenous felt they did. The 8 common stereotypes of Indigenous in healthcare is that they are less worthy of care, they are alcoholics and or drunk, they are just looking for drugs, they're bad parents, they're irresponsible and or uncompliant, they are less capable, and they're unfairly advantaged. These stereotypes lead to discrimination, which lead to less access, which cause poor outcomes. Poor outcomes can be seen as long wait times, negative personal interactions, minimizing issues, rough treatment, medical mistakes, and also creates harmful mistrust between the health care system and Indigenous people. Joyce Etchewan was a Tikmek woman and, more importantly, a mother of 7 children living in Monwan, Quebec. Before the incident, Joyce was already making frequent visits to the hospital and had a heart condition that required to have a pacemaker. September 26, 2020, Joyce was admitted into the hospital due to stomach issues. Allegedly, Joyce asked to be restrained to a hospital bed, but this has been questioned whether or not it's true and if she actually asked for that. Joyce starts a Facebook livestream, which is usually used as a means of translating French using a cousin from over the live. Ignoring her concerns about her allergies, she was administered morphine. Hospital workers were overheard over the live stream verbally attacking her, saying that she was stupid as hell, she was only good for sex, and how they were the ones paying for this. After the nurse realized that they were being filmed, she attempted to delete the evidence but failed. Joyce then later passed away that day. One nurse and one hospital employee were dismissed after the incident. Indigenous 45-year-old Brian Sinclair from Manitoba passed away in the emergency room on September 2008. Brian was requested after seeing a family physician to go to the emergency room. So later he entered on a wheelchair with an easily fixable bladder infection. For the next astonishing 34 hours, Brian was unattended and passed away from the infection. There are many witnesses testified that the employees of the hospital were assuming that Brian was homeless and drunk. Meanwhile, the nurses are arguing that they simply did not see him, even though there is a camera footage from the hospital of staff walking by him numerous times. Brian's death was easily preventable, but racism and stereotyping is the reason for his death. Along with Joyce and Brian, there are hundreds, thousands even, of cases of mistreatment and racism against Indigenous in healthcare. Thomas Favel, who received unnecessary bruising across his entire body. Pearl Gambler, who is neglected and forgotten in hospital, delivered her baby without any the requested help. This baby would then be neglected and would pass away, and Gambler would not receive any explanation of her child's death. An Inuk teenager whose name was not publicly released spent a night at Batchaw Youth and Family Center's facility in Prevost, Montreal, crying for medical help and puking in pain. Instead of being brought to the hospital, he was put in basement isolation for several hours. Eventually, he was taken to the hospital in handcuffs, where he finally received the required surgery. These are just a few direct examples of many documented cases of the cruel racism brought to the Indigenous in our healthcare system. So, what in Canada is being done to combat this issue? I'll present 6 recommendations. The BC and Canadian government apologize for the still ongoing systemic racism inside the healthcare system. The Government of Canada works together with Indigenous groups to try to develop policies and legislative changes. An accessible, supportive, and well funded resource to aid in navigating the healthcare system for Indigenous peoples. There is better education put into place for health workers teaching about Indigenous issues and culture. That all individuals involved in the healthcare system do their own personal part in avoiding racism and hurtful stereotypes. Supportive measures to increase and encourage more Indigenous health workers and officials like Nadine Caron. Nadine Caron was the first female Indigenous surgeon in Canada and has been a great role model for other aspiring Indigenous who are wanting to enter the medical field. In her life, she is constantly hearing other medical professionals criticize Indigenous families for avoiding health care due to mistrust. Karen says that these medical professionals fail to acknowledge the Canada's historical mistreatment of Indigenous peoples and how it has bred this mistrust. Karen, on a CBC interview, shares some of her experiences at work. After another surgeon finished his surgery and exited, Karen says that after he sat down at her and some other colleagues' table, that he said, "If I never operate on another Indian, it'll be too soon." Karen was shocked by this and calmly says, "If you don't want to operate on an Indian and get paid, you certainly won't want to eat with an Indian for free," and leaves the table. After she left the table, all the others, also sitting at the table, left one by one, leaving the one who said the remark all alone. Karen also shares a few years later that he apologizes and says how whenever he operates on an Indigenous person ever since then, he always thinks back to what he said and how he realized how wrong it was and how hurtful my assumptions and biases and stereotypes were. Karen ends the interview with saying, "This is the apology that the Aboriginal people of Canada are waiting for." I had the pleasure and privilege to interview Dr. Andy Gupert, who works as a family doctor and does clinical work and patient work in small towns, hospitals, and clinics all over Canada. When asked whether or not she thought there was still racism in Canada's healthcare system, she said that it's definitely still an issue, but it's slowly getting better. In terms of day to day, Andy says it's common to sometimes hear other doctors making comments using hurtful Indigenous stereotypes. She suggests that the main problem is the systemic racism, which is causing more issues. A piece of her schooling had a course called Medicine and Society, which is dedicated to learning about Indigenous culture and heritage. But this was just a small little piece of it. There also is a required course about anti racism that was required for Andy to renew her physician license. She also mentions of a colleague where the Indigenous Culture Safety Lecture was scheduled a week before exams at 8 a.m. Only 10 out of 200 people showed up for it. And he says that something the hospitals have done is they added an Indigenous patient advocate whose role is to help Indigenous people navigate the healthcare system as well as transport from rural communities to hospitals. She says that another positive change is the language accessibility. That if needed in Hay River, there is language services for all 11 local Indigenous languages. Also, the hospital signs are in 4 languages, and they even have fire pits for smudges. There are options for elder consultation available at hospitals as well. Even with all these positive changes, Andy admits there's still a way to go. A big problem she talks about is that they don't get much teaching on all the local herbs and how they can react with the medications that they prescribe. For potential solutions, Andy says that it's such a huge question, and without working with Indigenous people themselves, it will not work. You have to work with people on the ground and local members and figure out what their needs are. To finish off, Andy says addressing housing, income, employment, poverty, access to care, access to cheap or nutritious food would all do way more to the overall health of our Indigenous communities than just having a better hospital or better medicine. And to conclude this video, my opinion. I found Nadine Karen's story about her dealing with racism with a coworker very powerful. especially the fact that her coworker who said those hurtful words later then apologizes and truly shows genuine change and regret in himself. What Andy Gupert said about how addressing housing, income, employment, poverty, access to care, access to cheaper nutritious food would all do more to the overall health of our indigenous communities than just having a better hospital or better medicine is something I agree with, and I think those areas should be more a priority. But racism in healthcare is clearly still an issue, and an issue we should still fight against. We must remember Brian Sinclair, Thomas Favel, Pearl Gambler, Joyce Echawan, and the many unnamed in this video, who are victims of racism inside Canada's healthcare system.